United for Sight is an American-based NGO, and they've been in Ghana for 4 years now. They usually send volunteers from the States. The volunteers are doctors, optometrists, nurses, students. Majority of them are students. And what the volunteers do is that when they come to Ghana, they team up with Ghanaian eye nurses. And then they go to remote places, villages, and look at people's eyes. They screen them. And those who need surgery for either cataract or glaucoma or pterygium, they are referred to a hospital for the surgery.
My message, which is titled Jesus, the bread of life. Surely he is the bread of life.
You can reach them by telephone 021 66
Usually, like what we did today, when we go in the morning, we give some health talk to the patients. And then we first meet the chief to introduce to him that we are on the ground, we have come to offer service or to render services for his people. And then from there, we do registration. If we have some post-op patients that we have operated before, we first see the post-op patient before we see the new patients. After we register, we do the visual acuity, that is how far the person can see. And then from there, we'll go straight into the examination process. And then in the examination process, we have other steps that we do. And the steps are first, I check the anterior part of the eye to know that the anterior part is okay. And then I also check the posterior part. And then from there, if the person will need medication, and then I prescribe some medication. Like patient that needs surgery, I refer them to the ophthalmologist, or patient that needs special care, I refer them to the ophthalmologist, Dr. Clark at Crystal Eye Clinic.
So when these patients are identified in the field needing surgery or other treatment, they are brought together in a bus. And then we examine them. Those needing surgery, the surgery is done that very day. That's why I told the engine not to crack.
Light off, no, with the fluid, we don't
After the surgery, we cover the eye, and then if they are not from far, they go back and come the following day. Those who are from far, we find a place for them to lodge. So the following day when they come, we remove the plaster and clean the eye, and then that's it. They start seeing. Maybe examine them and give them eye drops.
Yes, because there is no sickness. It's inside
And then we normally see them again in a week, and then again in 2 weeks. Yes. And then after 2 weeks, if everything is fine, we ask them to meet the team again in the field.
I discovered United for Sight from the internet, and that was in 2004. And I saw that there are a lot of people in the camp that needed help, especially for their eyes. A lot of people who have eyes problem, and I was trying to trace an organization that could really come to be a help to these people. And then as it happened, I was able to get in touch with United for Sight through the internet, and I right away wrote to Jennifer Staple, and she replied. And I encouraged her to start a program here. Initially, we had, let's say, close to 50,000 persons here at a time, but repatriation had taken place, some have gone by, but roughly we may be around 46,000 right now. And then, to be sincere, since I've been here, Unite for Sight is the only organization that I've seen here that are giving their services 100% free of charge.
Those that are having cataracts, it's useless to them because they can see. They cannot do their farm activities. They cannot go about doing their normal activities. So that's why we usually refer them. After we refer them, they come back. It's very useful. They appreciate our effort, our service we render for them. So when they're having cataract, it's like it worry them. Am I going to see? And usually in the villages, patients cannot afford to pay the surgical fee. So when we go in the villages, they feel happy and they feel released that we come to give them free services, like the medication, like the surgery that we offer for them, the glasses, they feel very released, yes. Oh yeah, some of them have had a cataract for 3 years, 4 years. Yeah, so they already forget about themselves. They are like, nothing can be done about me again, neglected, but when we go there, we get them reassurance that, something can be done, something can be done.
My eye, I will not see. But this time now, I dey see. So I tell you, thank you. You people send your money here, we free now, I dey see. Oh, God will pay you. God will pay you. Your thank you plenty. Your thank you plenty. That's all. Thank you.